Spaying and neutering pets has become one of the most common and socially accepted practices in modern pet ownership. In fact, in the United States alone, surveys show that over 80% of dogs and around 90% of cats are sterilized, making it the norm rather than the exception. The reasons are both practical and ethical, preventing unexpected litters that often end up in shelters, reducing the suffering caused by pet overpopulation, and improving the overall health and behavior of companion animals. For many pet owners, it's seen as a responsible step, recommended by veterinarians and even required by some adoption agencies or pet-friendly communities. But while it is common, it is not without its complexities, and understanding both the benefits and potential drawbacks is key before making the decision. One of the strongest arguments in favor of spaying and neutering lies in the health benefits. For female pets, spaying removes the uterus and ovaries, which eliminates the risk of uterine infections, like pyometra, a life-threatening condition, and dramatically reduces the chances of ovarian or mammary cancers. Studies show that dogs spayed before their first heat have less than a 1% chance of developing mammary tumors later in life, compared to over 70% risk in intact females. Male pets also gain major health advantages. Neutering eliminates the possibility of testicular cancer and significantly lowers the risk of prostate problems. These medical benefits can translate into longer lifespans. Statistics suggest neutered male cats live around 62% longer, and spayed female cats live about 39% longer than their intact counterparts. Beyond disease prevention, sterilization can protect pets from reproductive accidents, like complications during pregnancy or birth, which can be dangerous and costly for both animals and owners. Health is only part of the story. Behavioral changes are another major reason owners make this choice. Unspayed females can go into heat multiple times a year, which brings loud vocalizations, restlessness, and unwanted attention from male animals. Spaying eliminates these cycles, making life calmer for both pet and owner. Neutered males are less likely to roam the neighborhood in search of mates, reducing the risk of traffic accidents or fights with other animals. They often show fewer undesirable behaviors such as urine marking, mounting, or displays of dominance that can make them difficult to manage. Some pets even become more affectionate and focused once their hormonal drive to reproduce is gone. For families living in urban areas or apartments, these behavioral benefits alone can make spaying and neutering an attractive option. On top of health and behavior, there's a practical, financial advantage. One spay or neuter surgery, though it carries a cost, is far cheaper than raising an unexpected litter of puppies or kittens. Feeding them, vaccinating them, finding homes, or worse, surrendering them to a shelter, can become overwhelming. By preventing these situations, sterilization saves time, money, and emotional strain. It also relieves animal shelters, which are often overcrowded and underfunded, from the endless cycle of caring for and rehoming unwanted animals. In this sense, choosing to spay or neuter doesn't just help your own pet, it contributes to the well-being of animals in your community. But despite all these positives, there are disadvantages and potential issues that owners must consider. First, there is the unavoidable reality of surgery. While generally safe, every procedure carries risks, such as adverse reactions to anesthesia, postoperative infections, or complications with stitches. These risks are low, but they do exist. More common are the metabolic changes that follow sterilization. Many owners notice their pets gain weight more easily, since hormone changes can reduce metabolism and appetite regulation. Without proper diet adjustments and exercise, obesity becomes a real concern, especially for cats and certain dog breeds. There are also long-term health debates. For example, spayed female dogs sometimes develop urinary incontinence as they age. Some studies suggest that large breed dogs sterilized too early may face higher risks of joint problems like hip dysplasia or cruciate ligament tears, as well as certain cancers like osteosarcoma or hemangiosarcoma. Although research is ongoing, it's clear that the timing of surgery can play a big role in how risks balance out with benefits. Another drawback is that sterilization is permanent. Once it's done, the pet will never be able to reproduce. While this is the entire point for most owners, it can become a regret if someone later decides they wanted to breed their pet. Additionally, While spay/neuter often improves many unwanted behaviors, it is not a magic fix for everything. Hormonal changes may reduce aggression in some animals, but in others, especially those predisposed to anxiety or fear, behavior issues might persist or even worsen. This unpredictability means owners should see sterilization as part of a broader approach to training and care, not a complete solution on its own. Even with these concerns, the majority of owners still choose to spay or neuter, and the reasons are clear. The procedure is viewed as the responsible thing to do, protecting individual pets from disease, making them easier companions, and preventing them from adding to the overpopulation crisis. In fact, many communities, shelters, and adoption agencies require sterilization as a condition for taking an animal home, reinforcing it as the standard for responsible ownership. For most pet lovers, the peace of mind knowing their pet won't suffer from reproductive illnesses or contribute to stray populations far outweighs the potential negatives. Understanding how sterilization affects pet behavior is also important. On the positive side, pets often become calmer, more manageable, and less likely to engage in mating-related behaviors that frustrate owners. On the other hand, some may show changes in energy levels, weight, or anxiety. This is where an owner's role is crucial. After surgery, pets need careful attention, maintaining a healthy diet, encouraging regular physical activity, and offering mental stimulation to keep them happy. If behavioral issues appear, working with a veterinarian or a professional trainer can make the adjustment smoother. So, who should definitely consider spay and neuter, and who might want to think twice? For most families, urban dwellers, and everyday pet owners, sterilization is an excellent choice, as it prevents hassles, promotes health, and avoids unwanted litters. For shelters, rescues, and communities, it is vital to keep animal numbers under control. But for breeders, working dog handlers, and owners of large breed dogs, the decision can be more complex. These owners may benefit from waiting until the pet is physically mature, or exploring alternative options like hormone-sparing sterilization, which prevents reproduction but leaves hormones intact. Ultimately, the decision should be tailored to the pet's breed, size, age, and lifestyle. Modern veterinary medicine has also introduced new approaches to sterilization. Traditionally, spaying meant complete removal of the ovaries and uterus, and neutering meant castration. Today, alternatives such as vasectomy for males or hysterectomy for females allow pets to remain sterile without losing all hormonal function, reducing some of the long-term risks linked to traditional methods. Veterinarians are also more mindful of timing. While cats and small dogs can be safely sterilized as early as a few months old, large breed dogs may benefit from waiting until they are 9 to 12 months or even older. Beyond individual pets, community methods like trap-neuter return programs for stray cats have become an effective way to humanely manage populations while preventing the endless cycle of breeding and euthanasia. In conclusion, spaying and neutering pets is far more than just a medical procedure. It is a decision that touches on health, behavior, community welfare, and the bond between humans and animals. While it comes with certain risks, the overwhelming evidence of its benefits explains why it has become such a widespread and socially supported practice. The key for every owner is to make an informed choice, guided by veterinary advice, considering the unique needs of their pet. With modern options, careful timing, and attentive post-surgery care, spay and neuter remains one of the most powerful tools we have to improve the lives of pets, their families, and the communities we share with them.